Hi, my name's Rhian and I am the Principal Osteopath at Not Just Backs. So you're receiving this little video. You should have just had your first appointment with us, or that you've been before but not for some time. So I'm just wanting to explain what you're going to sort of expect post-treatment, and also just to welcome you to the Not Just Backs community, and that hopefully you'll feel cared for and looked after while you're with us. So osteopathy is a healthcare system. We are not just interested in chasing your pain. Obviously, pain relief is a big part of what we do. But however, what we are aiming for is to educate you about some lifestyle changes that you may need, maybe some dietary advice, just to help you understand your problem a bit better, how to manage it yourself, especially for the patients that come into us that have long-term issues. We are really looking to working with you to help you feel a lot better and to recover as your body sort of takes it, really, because obviously not everybody recovers in the same way. And it takes time for bodies to heal. You know, you haven't just done this. It's taken a long time for your body to get to the state it's in now. A lot of the time it's over years, hence the sort of detailed history we take, and we go back, and some of you, we go back to birth and childhood injuries as well. So, you know, it's taken a long time for you to get to this point. So it's going to take a good while probably to get you better. Now, sometimes the symptoms can stop quite quickly, but your body is still in a state that actually it can return again. So we want to get you to the point where we're happy to leave you so that you can then carry on and strengthen your back and get it stabilized, or shoulder, or wherever your problem is, so that you can then lead a better lifestyle and stop causing the problem that you're coming to see us with. So after treatment, some of you will feel sore. From experience and research, it's shown that 50% of you will have some sort of ache or discomfort following your treatment. So this is quite a normal thing. This is because we're putting an input into joints that are obviously inflamed. And obviously working on muscles that are tight. So sometimes it feels like a bit like after exercise, when you start to feel stiff and sore, that can happen. Other times the body can then just suddenly flare up a bit more and you get quite a lot more pain. So this is normal. Let your body calm down. Give yourself 48 hours. If after that you're still in a lot of discomfort, then you need to contact us. So you can either phone the receptionist and say, get your osteopath to call you back, or you can email us on our patient care email, which is patientcare@notjustbacks.com. Then we will give you advice on how to calm things down. Obviously, the next time we see you, the treatment then will be varied so that you don't flare up as much, because some people are much more sensitive than others, and we have to learn your body, basically. And that's where it's quite nice, where we have patients that we see regularly. We get to know how they respond to treatment, and we can then adjust treatment accordingly to their problem. So don't panic if you are sore. It is quite normal. And if you are not coping with it, then you call us. That's the key to this. But what you must do is read your little leaflet that we sent with you in your green pack. And it has post-treatment guidelines on it. And there are things there that you really shouldn't do post-treatment. And that is physical stuff generally, your gardening, your housework, prolonged sitting. So if you're going, please don't go on a long drive after your treatment. So long drive is 45 minutes plus. And also, if you're at work, is not to sit there for hours on end. You make sure you get up every 20 minutes and move around, even if it's just, you know, you're on the telephone to somebody and you stand up and have a wiggle, just to get you moving, because the more you're still, the longer you take to heal. So it's good to get that balance between not overdoing it, especially if you're exercise keen, which is great, but you just need to tame it down. So it's like going for short walks to start off with, just to test your body and see how far you can go. Your osteopath may have given you some exercises to do after your first appointment. Some of you will have some of you won't. You generally will get some at some point, but it may not be first thing. But if you have been given some exercises, then please have a go at them as to how your osteopath has recommended. A lot of you will get it via our Rehab My Patient software. So we will send you the exercises via your email, and there will be videos on there on how to do the exercises as well, just in case you've forgotten. Because in the appointment, there's a lot of information that's given to you. And of course, what do we all do when we get home? We completely forget what we've said. So you will have also your patient recovery leaflet that you would have been given. And on there, it might, you know, the osteopath hopefully has written down ice, or, you know, maybe if you need to take meds, just to remind you of what to do following your appointment before we see you again. So that's really what I wanted to say. I will pop up again in a few days' time, just to see how you're getting on and to explain a few more things about what we do at the practice as well, because it's just to take you through a journey. Obviously, some people are coming in with back pain, some people are coming with headaches, some people are coming with shoulder problems, but generally they have a course that they run through, and so I will be popping up just to checking in and maybe giving you a little bit of advice on what should be going on next. So it's lovely to meet you all, and we look forward to seeing you back in practice soon. Have a good day. See you soon. Bye-bye.